Hello, OT friends, and welcome to the Uncommon OT series. I'm Patricia Modis, and I'm your host, a Filipino-American, native New Yorker, currently based in Los Angeles, bulldog mama, and an uncommon occupational therapist myself for the past 22 years. On this podcast, you will hear me proudly feature the unique careers of occupational therapy practitioners working in non-traditional and role-emerging practice areas, settings where OT is uncommon. I invite you to receive a dose of OT inspiration, to learn, to think outside of the box, and to be energized and motivated to follow in these unconventional paths. Happy listening! Before we begin this episode, I want to extend a special thanks to Picmonic, our sponsor. If you are an OT or OTA student looking for an excellent learning resource and study aid, Picmonic might be for you. Whether you're studying for your classes or getting ready for the NBCOT exam, it is a visual mnemonic learning tool that has been research proven to increase retention and help students ace their exams. It uses audio-visual learning and intelligence-based repetition algorithms to help with long-term retention while studying. If you're interested in trying it for yourself, sign up today using the link in the show notes or using the code TRANSITIONSOT to score a discount of 20% off your Picmonic membership.
Welcome back, OT friends. Today, I am super excited to bring to you not only one, but two special guests. Today, we are joined by Colton Sayers and Michelle LeRoy. They are occupational therapists who are co-directors of an LGBTQIA+2S Fellowship, and they're here to tell us all about their great work. Welcome to the podcast.
Awesome. Thank you for having us.
Happy to be here.
Thank you both for taking the time to inform us. Our goal here is to, just share with our OT colleagues about the wonderful work that you're doing, what you've created in this fellowship, and also to give us some takeaways on how we can really serve this population best. I've been looking or searching for guests. I love what you've created because it will resonate. It will absolutely resonate because, Colton, this was your capstone project. And there are so many OTs out there right now kind of trying to develop ideas for theirs. And again, what you've been able to create, the position that you've been able to create, with I'm trying not to give it away, the position that you've been able to create based on your capstone project just sort of, blows my mind. I'm super excited to share. So I'd love for you to get us started just by, tell us a little bit about yourselves, if that's okay.
Awesome. Yeah. Thank you again for having us. We're really grateful for this opportunity to kind of promote our fellowship, but also kind of talk about, OT care and LGBTQ health as well in our country with everything kind of going on right now. I think it's a really important conversation to have and just support this population as much as we can. I'm Colton Sayers. I'm an occupational therapist. I work at UC Health in Cincinnati, Ohio. My primary kind of role at UC Health is a outpatient occupational therapist, working primarily in a neuro population, but also I'm starting to do some more work in primary care for LGBTQ population. I'm also the education coordinator at our healthcare system, so I coordinate all the students and capstones that come to our clinics. And then, which we'll talk about here in a second, through my post-professional doctorate, I was able to create the OT LGBTQ Fellowship here at UC Health with the help of Michelle LeRoy. And I'll have Michelle kind of introduce themselves as well.
So my name is Michelle LeRoy. Again, thank you for having us. This is something we're very passionate about. My pronouns are they and them, and I'm happy to be a part of this. Right now, I'm a professor over at Colorado State University. I've been focusing on the transgender community for about the past 6 or 7 years. In terms of OT's role in working with that community, I was very happy to join Colton on this fellowship creation and launching it off. And I'm excited to be here.
Thank you again, both, for taking the time to educate us and teach us and leave us with some practical ways to apply some of these, ideas. Share with us what motivated you to contribute to the podcast today.
Yeah, I think for me personally, I think again, everything that's going on in our country right now, just with the political climate that we're in, I think it's more powerful more than ever to promote our profession in LGBTQ care, to support our patients that we see, and make sure that they are living like meaningful lives. For the fellowship specifically, I think it's really important to really educate our clinicians in a post-didactic way, to kind of expose to different learning modules that may not have been implemented in OT accredited kind of programs. Expose clinicians that are wanting to treat individuals in the LGBT community and really have that clinical practice. So working with individuals in our primary care clinics with our physicians here at UC Health that serve this population. Serving that community in different community organizations here in Cincinnati, but also abroad in different parts of the country. I really, again, think it's really important to want us to kind of get our name out, see, other OTs that might be interested in an experience like this, and really help kind of that recruiting process, but also serve as a resource for a community here as an OT profession, but also healthcare in general. So yeah, I think for me personally, I think that's kind of the big perspective that I am hopeful that we're able to get out of this podcast for your viewers and everything.
I agree with Colton. These are very troubling times when you start to see some of the headlines. I also think there's a role for OT. OT is focused on occupational performance and participation of our everyday person. How can we enhance this and help help the person have full occupational performance and participation? And the members of the LGBTQ community face not only personal level barriers, but systemic level barriers in their life to being able to do that fully. And so if we can help OTs understand how to support that community better and opportunities we have, such as being a part of gender affirming care, whether it be supporting gender expression or gender affirming surgeries, whether it be understanding and helping the person who identifies as non-binary to understand how to come out to their peers and advocate for themselves. Whatever it is that we can do, there's so many different roles that OT can play right now. And everybody will say this. Michelle always has this line. She never stops saying this line, but I always say, if we don't step up and take those roles, someone else will. So if we can help OTs understand the roles that exist for them to take, it's a win.
Yeah, I agree 1000%. Now, is there anything that inspired or drew you to do this type of work?
I would say for fellowship specifically, so I went back from a post-professional doctorate about 3 years ago. And during that time, trying to find a capstone project, I was also going through some different medical kind of care of my own, and kind of from different, primary care physicians or like specialty care physicians I encountered during that experience. There was a feeling of shame with different conversations that we had together and stuff like that. Me being a healthcare professional and knowing the need and the importance of following with physicians. I don't know if I was in that healthcare kind of realm as an OT professional, I might have been in that statistic that I wouldn't like follow up with physicians or like get that medical care that I need. So having that experience like to myself, knowing that, I have different, intersectionalities and other individuals in the community that may put them at greater risk, I wanted to kind of create a healthcare like educational kind of system to help like better like OT professionals, but also healthcare professionals in general. So when I was going through that kind of experience, like kind of, again, trying to figure out my post-professional doctorate, UC Health, their community practice medicine physicians launched their first LGBTQ fellowship at UC Health. So it's a primary care physician kind of clinic, and it was developed by Dr. Shanna Stryker and Dr. Sarah Pickle. So when that launched, I had a meeting with them to kind of, find out like what, their education was, what kind of patients are they seeing in their clinics, because UC Health is a very big like healthcare system. So we kind of are in our little silos sometimes. And then I really kind of just describe them what OT is. I think a lot of physicians and healthcare providers think that OT is just that secular physical kind of component, treating like TBIs, CVAs. But when I talk to them, we look at the cognition components, the social component, the environmental kind of factors that individuals live in their daily lives. And after that conversation, they were, they said
Blown
that
away.
they said almost all their patients needed OT, and I was like, yeah, and that's I feel like that's like a big kind of trend. So really kind of starting advocating for just that care and like seeing patients from Dr. Pickle and Dr. Stryker's primary care clinics, and really kind of identifying those needs, and kind of seeing, we definitely need like an OT like fellowship that kind of really resonates with this population to, again, just better prepare ourselves and our profession to rise above and, provide that care that these individuals need. So that's kind of like what I was kind of inspired to kind of do this work. I know Michelle has some different perspectives as well.
And I came
Well,
from a little different route.
congratulations.
Yeah. I'm
Thank you.
grateful to Colton for doing all that. I came from a little different route. My oldest child came out as transgender, which got me starting to really explore. I had had friends who identify as transgender, but I hadn't really delved into the research around healthcare for that community. And as I started exploring, I realized that OT could play a role. So then I started getting involved myself. I hooked up with a surgeon who does gender affirmation surgeries and looked at some of the best care practices around that therapy could be involved with around both pre and post surgery. I started volunteering in an LGBTQ focused primary care clinic and providing pro bono OT services. And considering what could we do for pelvic health, what could we do to support mental health, all of those different factors. Then I also started exploring and providing services around gender care support for gender expression. And as I got further and further, I started being asked to give presentations. So I'd give presentations for student groups or at conferences regarding this topic or doing workshops. And so I was figuring things out, trying to disseminate information as much as I could. And then through COTAD, Colton and I hooked up. And when he talked to me about the fellowship, I thought this is exactly what I've been trying to do, is to get OTs to know about this and know more about this area and what they can be doing. So it seemed like a great idea to be a part of it. I was grateful when he offered to have me be a co-director with him. And we've worked really hard on building this to be a resource to others and to help educate OTs in a deeper level on how to help provide care to this overall community.
Amazing. Congratulate you both.
Thank you. Yeah, it was not easy at the beginning. So I can kind of talk about that a little bit too, beginning. So after meeting with Dr. Pickle and Dr. Stryker, I met with a couple, therapy directors and my capstone director, because I knew that's what I wanted to kind of focus on. But again, this can all be like a dream, but how are we going to like actually have like a position that is going to support this in a healthcare system? So I did like a lot of background kind of research with the help of Dr. Pickle and Dr. Stryker, just in the Cincinnati community. How is the LGBT community, getting those healthcare needs? What can an OT professional like kind of, again, supports? Are we just doing the physical components? Are we able to support them in that, cognition, that spiritual, that socialization, that, holistic kind of mindset? So really looked and kind of dug into the literature of, just Cincinnati in general, but then also looked at literature, how are OT programs throughout the country, providing education initiatives for students. So when we're going out into communities and as we are graduating in programs, how are we supporting that program? And, I found very like startling kind of data, again, not just the OT profession, but also healthcare professions in general, physicians, physical therapists, social workers. The average education that really supports like LGBTQ care is about 2 to 3 hours in these programs. And we have, a lot of, again, intersectionalities between, race, gender identity, social constructs that way, that we should be really focusing a lot on DEI in our healthcare system education. So I wrote a value proposition with the help of our director of rehab, our DEI vice presidents at the time, and then our corporate education department. And they all supported that and helped kind of, push it through the pipelines to our senior vice presidents and all the way up to our presidents, since this was like a new initiative. And so they read like the value proposition at a couple meetings with them, and they finally approved it in June of 2023. So then after it got approved, we really just started the ground running. Through my capstone project, we had like an outline of like the different, didactic kind of modules that we were going to have and everything like that, but didn't really have the full like assignments or like readings and stuff like that. So from June 2023 till now, that's what Michelle and I have been kind of working on, is, laying out the curriculum, but also having that clinical kind of case study and kind of looking at that as well. I don't know, Michelle, do you want to give a background, like just like the position in general from like the clinical and academic kind of
Absolutely.
piece? Yeah.
Well, and I want to add before we even talk about that, you mentioned 2 to 3 hours. That's if they discuss it at all, right? Across healthcare professions, not even just OT, across healthcare professions. If they get it, it's 2 to 3 hours. There's still many programs across all those professions that don't even touch it at all. But so our fellowship will be 60% clinical work and then 40% academic. The 40% academic will be covering a range of topics, everything from starting off slowly with DI, social determinants of health, to then going in deeper in terms of, okay, what are the health things we need to pay attention to for if you identify as gay, if you identify as bisexual, if you identify as transgender, what are the things that the research is telling us that are things that could crop up that we could address. Then going into also things such as neurodivergence. We know that there's a large crossover there between the LGBTQ community and those who are also neurodivergent, and many other topics that I won't go through all of them right now. As part of the academic side, not only will they be learning about those things and engaging with the community and, really digging deep into what we know and putting it into practice, but we also be having them do a capstone project where they'll be focusing on an area that they have a particular passion for. So that way they can hopefully leave our fellowship as more of an expert in that one particular area. So we're very excited about it. We already accepted our first fellow to be starting this summer. So
exciting.
We had great applicants and we felt very lucky to have such great applicants. And the person who's coming on, I think, will be fantastic as our first fellow.
Yep.
Wow.
We're excited.
I got goose pimples. Yeah, I'm just so excited. And, you're describing just an amazing experience, quite frankly, what and what could potentially be an amazing experience for an OT who's really passionate about this, right? You talked about doing 60% clinical work. So that means that tell us more about that. They're meeting with folks one-on-one, they're doing assessment.
Sure. Yeah. So right now at UC Health, kind of where like my part, like the rehab team, is more like outpatient. So we're starting the fellow, maybe the first couple of years just in the outpatient kind of clinic. So there'll be a couple of different experiences that the fellow will be able to do that we think is very unique and can really, help the profession in just different ways as well. So the fellow will have, again, supported time from their salary to kind of do a lot of academic work. So part of that academic work as well is going to be helping rounds with the physicians in their primary care clinics. So we're going to have the fellow round with Dr. Sarah Pickle, Dr. Shanna Stryker, and also their medical fellow in those doctor visits to help, identify different OT needs that may not be being looked at through like a physician lens. And identifying those OT needs to help kind of recruit them to, having those outpatient visits where the fellow can kind of have more of that one-on-one kind of time with those patients that need it. Again, looking at not just the physical components, but also those social emotional needs, those physical environments they may be in, those cognitive kind of needs. So yeah, we're really lucky that we'll be able to actually be in those primary care clinics because our position will allow that. And then recruit those patients into our outpatient clinics, as needed OT services, and then be able to bill those services through an OT kind of lens as well. So that's a really unique experience. We're also partnering with a healthcare system in Cincinnati. They also have a couple different locations throughout Ohio. It's called Equitas Healthcare Center. And this is a nonprofit LGBTQ clinic that's, I think, is pretty much specialized to Ohio. I think all their clinics are in different parts of the state. So our fellow will round in those healthcare clinics as well. And to our knowledge, and to the physician that's the head of that healthcare system, this will be like the first OT, actually in that clinic, providing those needs, asking, OT questions, giving advice to not just the patients, but also the healthcare providers. So we're very fortunate to kind of get our name into that healthcare center as well, just to kind of prove our worth. What is our profession going to do to help those patients that may need us? So again, kind of expanding our body of knowledge and just expertise into different healthcare clinics that have not been exposed to OT before is something that we are really proud of. And then also our fellow is going to be doing a lot of community work. So there's a lot of LGBTQ clinic or community kind of sites within Cincinnati. So for example, there's a organization called Caracal. They're an HIV prevention center, but also healthcare clinic for patients that may have HIV, but also do housing for low-income patients that have HIV. So it's a really great organization.
Mm-hmm.
So looking at just community, partnerships within the community that, again, don't have that OT lens or that mindset, and help having the fellow kind of give more of those perspectives. Our goal is, so I guess we always have goals, is to really kind of get into the pediatric kind of realm as well. Again, I know right now our political climate is very, fragile with the pediatric population for LGBTQ care. But our fellow that is coming has a lot of experience in pediatric care, so we're helping to get her in, different organizations that support that population too. So we're trying not to just focus on adults, because even though there's a great need, there's also that great need of pediatrics. So we're trying to kind of find some different experiences that way to have that whole lifespan care as well.
Yeah, and to at least have those conversations. Ah, what you've created is just so brilliant. I started earlier by saying that it's going to resonate, and particularly because there's so many different aspects to it, and there's your teachers are teaching, and that teaching will kind of continue, right, with whomever kind of gains the information. Just so brilliant. So congratulations, you brought a seat to the table, right? You brought the OT seat to the table, and now they won't be able to get rid of us.
Yeah.
We're there now, and I love that there's actually an OT there to give our perspective and to also inform them, okay, yes, they would be a great candidate for our service, or not, right? And to really be welcomed in that space. And I know that had a lot to do with you both in making that happen, and developing these collaborations. So again, I'm congratulate you, and proud. My gosh, that's so brilliant.
Well, that was one of the things when we were looking for a fellow. We were specifically looking for a fellow who would be able to advocate for OT in spaces where it doesn't exist right now, and that they would have the confidence to speak up in front of a room of doctors and say, OT should be working with this client, and this is why. So
Yes.
we're very excited to have these opportunities. We want to make sure we take full advantage of them.
Amazing. So with the fellow on board, excited to meet this fellow. What will be your role in terms of being able to support this person, this clinician?
Yeah. Michelle, do you want to kind of give
Yeah.
some back? Yeah.
So Colton is actually on the ground there. He will definitely be taking charge of the more clinical side of things and being there to help guide them, answer their questions. We'll both be involved in the academic side. I'm I'm a little bit more involved in the academic side in terms of maybe helping guide the capstone experience and doing some of that work since I'm a little bit further away and won't be able to be there on a day-to-day basis. That way the work is split. No one person is carrying it all. But when it comes down to it, we're both going to be involved in supporting the fellow. We want to make sure that they never feel like they're just abandoned and on their own and having to figure everything out. We want them to be independent and forward thinkers and a critical thinker and being able to advocate. But we want to be their safety net and the one who pushes them to think about things that they might not be thinking about yet as they're going through the experience. So again, Colton will be on the ground. I have a little bit more availability typically, so I'll be yeah, I've got a question now and Colton's with the client, right? So
Yeah,
Your
but I
backup.
also think our big role is just like the empowerment too. Like, I think our fellow is kind of newer to like the OT profession and just not like an entry level like grad, but just newer to the profession. So I think just empowering them to find their voice, have that advocacy. I really think that will be something that Michelle and I will be able to kind of forthcome with them. I think we also are kind of as we're developing the academic kind of modules and stuff like that, we've also recruited different OTs throughout the country to either evaluate our modules, but also there was also some OTs that had like a particular area of interest and like expertise in like our topics, so they helped like build a module out. So what we're hoping also is to kind of build that like mentorship program for the fellow. Potentially, if somebody has a particular interest that we have connected with, or have like that special interest of the module, we want to kind of connect them with that person as well to kind of have that mentorship too, if they're willing, and kind of grow their expertise in different levels of just education, clinical care, different ways of thinking. So that's our kind of goal as well, to just kind of make those connections too.
well, in our reviewers, we specifically found reviewers who identify as part of this community. We wanted to ensure that we weren't just looking at the narrow window, we hadn't considered things. So we found reviewers who identify as part of this community and also understand occupational therapy to give us feedback on everything we've created. And we're going back and making small revisions and tweaking things to ensure that our fellow gets the best experience possible.
Is there anything more specific about the fellowship that you'd like to mention? Anything maybe money matters related or duration, anything at all?
Sure. Yeah. So the fellow will be a year-long fellowship, and so they will start in July each year, and they will end in the end of last week in June. And then the idea is that we'll just keep hiring a fellow after our first one that starts this July. The fellow will have a salary. It is, since they're only doing 60% clinical work, the salary is about 60% of an entry level salary, so it's a little bit less. But we felt that was still like needed to like have that salary to support them, coming to maybe a new city or a new place of employment or area of practice, but also give them time to do the academic work. So it's not just your work like a medical resident would do. We're giving them 60% of their time to kind of do that clinical work, but also giving them time to do academic work. So that's really important to us too, just to kind of have that time based. They don't feel like they're stressed all the time, I guess. I'm kind of saying.
Yeah.
Also, in that year-long position, they will also have benefits. So they'll have health insurance benefits. They'll have a 401k for that year-long experience. And then UC Health is also a not-for-profit organization, so they can apply for student loan forgiveness during that year. That's an option as well. So again, not just having that salary, but also having that those benefits too, I think was really important for us to kind of push for a position. And then Michelle and I have also applied for a couple of different grants to kind of help like support different funding for if the fellow is going to present at a conference. So having the fellow having that grant money to pay for like flights or like that conference fees and stuff like that. So we're looking at different avenues and ways to kind of promote that funding. So the fellow's not, having all this out of pocket. They'll also be funding for like their capstone projects. So for different material or just different supplies that they may need. Again, we want to make sure that we're, being very cautious of just, money wise, purchasing different things during that whole year experience. So that's kind of what the role will be. And then we started for this year, we started like our enrollments, I think October, or no, we closed enrollment in October this year. So I think we'll probably do that same path. So we'll open the portal to apply in like July each year, close it in like the fall, and then we'll kind of start interviews like November, December. And then we'll be hopefully having that final OT for that upcoming year selected in like January or February time, to give them enough time before they come into like the July timeframe to like move, get settled in, but also have that connection with the fellow that is like already doing the fellowship right now, and like have that collaborative experience to kind of see what works, what was helpful for them, what maybe could have been improved. Just giving some different tips and tricks for the clinical kind of piece as well. So yeah, we're, I think, kind of lining that up pretty well, hopefully, to make sure that's an impactful experience too, coming in as a fellow as well.
Oh, how competitive was the application, just out of curiosity?
It was competitive enough that it was a hard choice.
Yeah.
Yeah.
I think
Again,
I
very
think we took a
exciting.
week to kind of decide. Yeah.
Yeah, a week.
Yeah, well, there was multiple people interviewing. So it wasn't just us interviewing, it was also the doctors interviewing and the heads of the different rehab departments interviewing. So it was a extensive interview process for the applicants. And we wanted to ensure we had feedback from everybody. But we did, the person we chose really stood out from everyone who applied. And so it did make it a little bit easier to decide quicker. And I think it's fine to mention her name. She's already given us permission. Her name is Bridget
Yep.
Farrell. She will be moving to join us, and we're very excited to have her.
Oh, congratulations. What is her name again?
Bridget Farrell,
Bridget Farrell.
Farrell. Mm-hmm.
We can include her. I'll find her LinkedIn profile and include it with our show notes. Yeah.
Bridget's coming from San Antonio, Texas, and right now, currently, she works in the foster care system with a nonprofit organization. And she actually, through her capstone project, kind of built her role in that department as well. So really excited. She's driven. She has experience for advocacy for her profession. And I think, like Michelle said, she'll be a great asset to our first fellow here.
Well, and she's newer to OT, but she actually came to OT after being a healthcare professional as a nurse for quite a bit of time. So she's been in the healthcare arena, found OT, switched to OT, and we just feel like her understanding of overall healthcare systems and the experiences she has in advocating, like Colton mentioned, will be a good fit for our first fellow.
Yeah, and I'm imagining also like the physical, the knowledge of like the biological system and from a nurse's perspective. And now I see you mentioned she worked in the foster care system, so that's sort of where her knowledge of pediatrics sort of comes in. So, wow, fascinating. And as I'm saying all of this, I know we're recording one episode and kind of clumping everything together, but I feel like I'm doing somewhat of a disservice by doing that. I feel like, Michelle, you and I can do an entire episode on just transgender affirming care, right? And Colton, you and I could do something entire, So yes, and I want us to do that, right? Just so that we can really truly inform. But yeah, that was just a thing that came to mind because there's so much to unpack. And even in just this like episode that we have, I want this to be practical. I want there to be lessons for our fellow OT practitioners. So kind of want to give you the baton and, what do you think are some really important things for us to know? I jotted down some notes here, like pronouns 101, right? Later questions like, when is it okay to just say LGBTQ plus, or do we say the whole thing? Like I've heard it sometimes said that way. So anything of that sort, because I think these are also similar thoughts that are going through other OT practitioners' minds.
Well, one of the things I like to talk about is sometimes it can be scary for someone who doesn't necessarily know a lot about the LGBTQ plus community in terms of starting to ensure, well, if I'm interacting with someone, how am I going to make sure I'm not offending them? And so you can't know everything from day one, right? It's a process of learning continually. OTs are always lifelong learners, but continuing to learn continually and improve your skills and improve your knowledge base to be able to be more effective and supportive of this community. And along the way, you're going to make mistakes. And so it's important to know it's okay to make mistakes. There is a right way to apologize if you make mistakes, right? So it's saying you're sorry, not over dramatizing the situation and being like, oh, I'm so sorry and I can't believe I did, because then you're making it about yourself. Instead
Mm-hmm.
of saying, I'm sorry, I understand what I did wrong, that I shouldn't have done this, and I'm going to try to do better next time. Because then it's simple, it's making it about the person you're apologizing to, and it's, saying, I'm going to work on this. I acknowledge I did something wrong. And so it's okay to make mistakes as you're learning. One of the things we are doing, and Colton, maybe you want to talk more about it, is we're actually realizing that our fellowship is a little bit more limited. We can only accept one fellow a year right now. And so we have another initiative that we've started. Colton, if you'd want to talk about that one.
Yeah. If I can, I'll talk. Can I talk about one other one before I go into the?
Yeah, of
Yeah.
course.
I think
Yes.
also talking or looking at not just the LGBTQ person, but also there's so many more intersectionalities that happen with this population. Again, looking at race, age, gender. Um, I worked primarily with adult population. I remember one patient that I was working with, an older adult, a gay male, and he, lived through the HIV epidemic. So having his experiences during that time when the healthcare for that population was again very discriminatory. The government was not, funding medical treatments to, help that population. So when I was treating him for the first couple, sessions, really building that trust with patients that way as well, because again, they have had experiences healthcare that's not supportive and stuff like that. So I think again, looking at that intersectionality, how does somebody look at a healthcare professional? How does somebody look at me as a OT? And really kind of using our therapy years of self to kind of get more of that. I guess like bond with them and really help through the OT process, I think is really important as well.
Well, and going along with that, there are simple things you can do to show that you're a
Mhm.
safe place, right? Even just introducing yourself with your pronouns is like waving that big green flag of, hey, I'm a safe place. I understand that there may be things that you might not otherwise disclose unless you know you're safe. Because there are a lot
Mm-hmm.
of discriminatory healthcare experiences, as Colton was mentioning earlier, that he's even experienced himself, that can occur in the healthcare system, unfortunately, for members of this community. So recognizing there are many forms of intersectionality and trying to make it clear that you are a safe place for them is so important.
And then, yeah, to go off of what Michelle was kind of introducing a little bit too. So again, since we are only able to kind of accept one fellow at this time every year, we felt it was important to kind of have different experiences for other OTs or healthcare professionals that want more knowledge about the LGBTQ population. So we are going to hopefully next year and a half kind of have like a library of just educational materials with different video resources that we will create that are kind of similar to like our modules that we were building for the fellowship, that OT professionals can look at, purchase, and kind of like learn from themselves. It'll be kind of more that adult kind of learning kind of mechanism that we'll kind of be implementing. But also, once we get, it up and running for like OTs, we want to kind of invite different healthcare professions as well. So at UC Health, we are in contact with the director of the nursing program at UC Health that wants to kind of do more gender affirming, practices for their program. That she is interested in kind of, building out different modules that will help just a nursing program. We envision, having physician like content kind of coming in that library, social worker content. So really kind of building, I think we talked like one of our meetings, like a college like library that's like different, allied health kind of college like content, medical content for physicians, social worker, nursing, and really just supporting different healthcare professionals in that understanding and knowledge. So that's what we are hoping to accomplish here in the next year and a half. And just, again, kind of build that community, that knowledge that we so desperately need as healthcare professionals.
Well, and we know there's a lack
Well,
of continuing education opportunities out there. So we've created all this work around educating, others around providing this care for the fellow. But let's not just limit it to giving it to the fellow. Let's create this continuing education experiences that people can choose to engage in from wherever they are.
wow. I'm extra thrilled. Yeah, I love this extra initiative that you're both taking on. I mean, who else better to do this, right, than OTs to kind of understand what all of these, different healthcare professionals and how they might need to understand the information. I think the OT lends itself very well to that task.
There's so many different avenues you can go down. Right now I'm involved. My research that I'm doing as a professor is looking at supporting the mental health of LGBTQ plus youth. And I'm using being in the schools as a little bit of a vehicle for reaching them. Opportunities abound, right? Whether you're more focused on pediatrics as I am, or more focused on adults like Colton is, it's really just seeking them out and understanding where they exist to be able to take advantage of them.
Yeah, and I think both of your experiences in academia are also contributing greatly to this initiative.
I think it just kind of really, again, I think just being like fresh off my like capstone and my like post-professional doctoral program, I think that really helped. Just looking at like different like learning styles too, because I went through a traditional like master's program, and then my post-professional was kind of like all online. So looking at different for a fellow, like supporting different like learning styles that our fellows may be having, introducing just not just reading materials, but also like watching different educational videos or going out and for their assignments, participating in those assignments out in the community. We have a social determinants of health kind of project where they will go to different parts of Cincinnati to really just immerse themselves in those different areas, and how do people access different their housing, or like going to like a supermarket, or how does that impact their health? I think we definitely did a really good job just having different experiences of learning that hopefully the fellow will be able to just apply, not just in the fellowship, but also as they graduate from the fellowship, and then those different avenues for where they will venture out afterwards.
Well, and we are trying to give them an experience also that, expresses some of the fundamentals too, right? So, for example, people sometimes, for example, if they hear transgender, they think, oh, well, the person's definitely going to go and one day they're going to have surgery, and they start making assumptions what those terms mean, but that it doesn't mean that. If you're transgender, maybe you'll get surgery, maybe you'll decide to go on hormones, maybe you'll decide to change how you're presenting yourself in terms of hair or clothing, but none of that is a requirement to be part of the transgender community. It's about finding your own pathway and figuring out what's right for yourself to express who you are if you're identifying as a gender differently than what you were born with. So, helping give those perspectives to really take that point of view that we do as OTs, to take a very holistic point of view of someone who's coming in and identifying as part of the LGBTQ plus community, and ensuring that you're treating them like you would anybody else, as an individual who has individual needs, and getting to know them at that level, while also taking into account that they do identify as part of this community.
Thank you for informing. Yeah, just for really educating me and our listeners. Any career advice for folks who are interested in the fellowship, for folks who might be interested in developing their own fellowship? Any advice of that sort?
So I think like for answer maybe like kind of like the fellowship kind of questions, stuff like that, or just like, developing different programs. I feel like I'm a very introvert by nature. So, advocating and stuff like that is something that I've had to like practice or just be more comfortable with. But I think like finding that passion that, as I, once I graduated from like my master's program and then, being out in the clinic and finding like those diagnoses that really like, interested me or like had like more of a passion to, I think just following that, getting more education on that, building relationships with physicians or other providers that, or even just connections with other OTs that have the expertise in those areas, I think was something that was helpful for me as I was, making this fellowship and, how would be like a good way to like introduce the value proposition. So I really connected with a lot of people from UC Health in those different departments. So yeah, I think finding that passion, finding those connections that will help you reach those goals, and then not being afraid to push a value proposition to the vice president of a healthcare system. Again, I'm a very introvert at by nature, but I think that passion, that need that I felt for this fellowship was so much bigger than what I was feeling that I could just kind of like push it through. So yeah, I think just not being afraid to do things, and if you mess up, and you try again. So yeah, I don't know. I feel like just OT wise, just having that I don't know, empowerment or just that drive and like finding those like niches that you feel like is going to be like your professional kind of career pathway.
Yeah, I have to second Colton. I was meeting with capstone students actually this morning, who are getting ready for their capstone experience. And the thing that I was emphasizing to them was exactly that. Make sure you're doing something you're passionate about, because when you're doing something difficult, especially if you're doing something in a little bit more emerging area of practice for OTs, where there aren't as many OTs doing it or there aren't any OTs doing it, there's going to be barriers. There's going to be times when you're going to be pulling your hair out because you don't have someone to call and say, how would you do it? Because no one else is doing it, right?
Mm-hmm.
So there's going to be moments of frustration. There's going to be moments of tears. There's going to be moments of joy. And the thing that's going to keep you going through the hard parts of it will be that passion and that love for what you're doing. So if you want to either, be a part of the fellowship or start your own fellowship, you really want to be engaged truly and have the passion to do the work, not just be doing it just to have another experience, right? So, passion. Second, you, Colton, definitely passion.
Thank you so much, you both. Such great advice. If any of our listeners were interested in reaching out to ask you any questions, to connect, to learn more, would it be okay for them to do so?
Yeah, definitely. We have an Instagram page right now that we do a lot of our communication through. It's OT underscore LGBTQIA+2S and then underscore fellowship. So yeah, we do a lot of like postings. You could also email us. I don't know if you want to put our emails in like the like show notes and stuff. Okay.
Yes,
Yeah.
I
So
will.
definitely reach out to us as well through email. We would gladly to like set up a meeting, kind of discuss like fellowship, different LGBTQ care options that you feel like, that you're maybe experiencing in the clinic that you might not talk through. So yeah, we're definitely big into like building that community of supports, and also just collaboration between other OTs. I think will be beneficial for our profession as well. So we're not just in silos. We can also know like what other people are doing in the country and everything. So yeah, definitely.
Well, and Colton's being kind. He does the Instagram page. Email me. He's much better at that kind of thing than I am. There's no we there, to be honest. It's all Colton.
Oh, you're a team.
Still team, yeah.
Yes.
So thank you so much again to you both for educating us, for the wealth of information that you've shared, for providing me a safe space to ask some questions. I just feel like I have such a resource in you now, and I, love that. I hope our listeners will take advantage of that. What I've learned today is that it's best to ask, and it's okay to perhaps say the wrong thing. However, being able to acknowledge that, there's a better way of, yeah, just expressing oneself. Is there anything else that you want our listeners to take away from today's episode?
I think language is very powerful. So we talked a little bit about making a mistake, but there's language that's very powerful, even from something as simple as instead of saying, "Oh, where's your mother and father?" Instead of saying, "Oh, where are your parents?" Right? Or, "Oh, who?" Instead of saying, "Oh, are you married? Who's your husband? You know, do you have a partner? Are you in a, long-term relationship?" There's so many different ways to make an impact with language. And if you just work at integrating them into your everyday life one at a time, before you know it, you'll be a very safe place for those you interact with.
Thanks for those
Yeah.
examples.
And I feel like for me, I think just, how you make people feel. Again, we're in a very fragile state in our country right now. So I think, a, a like goal for me is to just make sure people every single day with every patient that I interact with, again, looking at those different intersectionalities that we have with our patients, not just from the LGBTQ population. We have patients that are lower socioeconomic status. They may be taking transportation to outpatient visits or having concerns with putting food on the table. There's so many people that are just going through different life events right now. And just, greeting them with a smile, asking how their day was, finding different solutions if they are struggling. Do we recruit or make those connections to a counselor that they can, connect with a little bit more? Do we need to make sure they're getting to their physician? So I think just going the extra mile right now, as we're going through, again, what we're going through right now in our country, I think would be really impactful and just kind of give that more of that humanistic experience as we're doing our treatments and interacting with our patients on a day-to-day basis.
When I'm going to add on to that, Colton, because you just got my mind going around, so often we talk to OTs or healthcare professionals or our OT students around DIJ issues, where they probably even get tired of hearing, DIJ, DIJ. But it's not just about DIJ and this intersectionality. When Colton and I talk about it, we talk about not only that intersectionality, but also understanding your own positionality in regards to that. Where are going to be your internal biases that maybe you're not as aware of, that are implicit biases that exist in you that you need to battle against? Where are the areas where you can really connect with someone because of your positionality and help them know that maybe you've experienced something similar and you understand their experience at a deeper level. So taking that DEIJ and the intersectionality and meshing it with your own positionality and truly reflecting on what that means for your interactions, I think is so important.
Yeah. And that's almost the next level, right? That's first learning the basics and then applying it. And so, yeah, so again, so informative. I very much appreciate your time today and sharing with us about the fellowship. And yeah, just some practical tips that we can really take to the clinic with us. Looking forward to hearing more about how the first fellow,
Yeah.
how the first fellowship went.
And thank you for having a podcast that really focuses on, OTs who are doing innovative things out there to help others know about it. It's a wonderful podcast.
Yeah, there's a whole lot of us doing amazing things and, places where none of us have ever been before. And I find it giant pleasure to be able to connect with OTs like yourselves who are just really paving the path for others and yeah, informing us OTs who have been practicing for a gazillion years on how to be better OTs we're lifelong learners, as you mentioned earlier. And, these are the types of things that really excite me. I feel like I can really take some of the advice that you provided today to the clinic tomorrow and feel better about my ability to practice.
Thank you.
Yeah, thank you.
And that wraps up another inspiring episode of the Uncommon OT series. Connect with me at www.transitionsot.com. And don't forget to sign up to be part of the Transitions OT community. By doing so, you'll receive my latest compiled list of uncommon OT practice settings, the latest news on mentoring offerings, uncommon OT live events, non-traditional OT resources, and more. You may also follow me on my social media pages on Instagram and LinkedIn. And if you love this episode, head on over to Spotify, Stitcher, Apple, and Google Podcasts to follow, rate, and leave a review. I also ask you to consider pledging your support to my Passion Podcast project by being a patron on Patreon. It is very much appreciated. Sending big OT love. Thank you so much for listening. Until next time.